Telehealth, remote video visits in hospice. Gina Montagna. Video conferencing. Telehealth in hospice and its relationship to current or future practice. Video conference with patients and family for home hospice is a new concept. Very few hospices utilize video teleconferencing at all or partially. Any change presented to healthcare needs to include access, cost, quality, and satisfaction of all parties. Having the access to a video telehealth nurse can reduce anxiety for families, knowing that the nurse is available in a few short minutes. Communication is enhanced because families do not have to try and describe a situation. The nurse can see it. Symptom management is better because there is reduced wait time for nurse evaluation of symptoms. A transition from illness to health, or from health to illness, and a move from a hospital to a home after an exacerbation. Patients and families feel vulnerable, unsafe, uncertain, lost, and unsupported. Telehealth participants feel more involved in decision-making, self-care planning, referrals to other services, and understood more clearly their own health issues. Why is telehealth important to healthcare informatics? The primary goal of telehealth technology is to attain a unified interoperability across all healthcare systems. Updated technology includes the use of application program interfaces, APIs. APIs have all system interface with each other. In the learning health system, data will be created and collected automatically during the routine delivery of care, including telehealth, lessening the need for duplicate entry of data into registries and other equivalent systems. One hospice company that has telehealth is Angela Hospice Home Care in Michigan. The hospice was able to acquire funding through donation for a telehospice program. They use a tablet that's given to the patient and family. They only need to push one button to call the nurse, and the nurse will video call back through the tablet. The patient will hit the accept button. It is offered to families and caregivers who are open and accepting the device. Supportive caregiver tools can be reviewed through telehealth, such as stress management, coping skills, social support, and application assistance. Web-based platforms give family disease-directed information and links to resources that are relevant to the individual. Remote monitoring systems for EMS, weights, detect falls. Apps are identified for use in support groups, family scheduling, transportation, and doctor appointments. Some of the research articles that I used. In the first one, as discussed in the previous slide, the caregiver is enhanced, which is important to the hospice client. The second article discussed how telehealth may not necessarily decrease costs, but increase overall spending. There is the third one. It's a PDF booklet for telehealth, and it was published in January 2019, and it's updated every January. It's published by the American Medical Association, and the booklet reviews sites, distance practitioner services, billing and payment, and has other resources related to telehealth. Although it's aimed at the fee-for-service provider, it has the current government rules on telehealth. For the National Consortium of Telehealth Resource Centers, it's a nonprofit organization funded by the Department of Health. Provides unbiased information and education on telehealth, specialty to rural and high-need populations. Short and long-term assistance, training, educational training, and materials. It'll be useful when establishing a timeline plan. So there's benefits and potential issues: cost effectiveness, security, usability, acceptance of the adoption, and ethical and legal concerns. Benefits first, the issues. Home-based telehealth programs with video conferencing result in patients with reduced hospitalization and increased length of stay on hospice when compared to the usual care. Video telehealth and hospice can have some downsides. user friendliness for all, replacing live visits, integrating systems into existing medical records. Hospice is a healthcare service where trust is essential, and not having that face-to-face interaction can decrease trust and effectiveness of telehealth. Privacy and confidentiality. Consumers should be informed of the risks. They can choose to participate or not in telehealth communications. The nurse must know when to urge a face-to-face level or higher level of care. Patients not following up and complying to recommendations will continue to be an issue. The easier access to communication will hopefully motivate most patients to adhere to the treatment plans because it's more convenient. Nurses must still create a relationship of trust with patients. Ethical actions are the result of acting in the best interest of the patient and their trust. Legal issues. In 2019, the Physician Fee Schedule Final Rule, CMS added 3 new reimbursement codes for remote patient monitoring that does not involve a face-to-face visit. The 2020 Medicare Advantage and Part D flexibility proposed rule introduced substantial leeway for Medicare Advantage plans to increase the telehealth services they offer to their recipients. Potential legal issues include the compensation between the parties be consistent with fair market value, the relationship between the parties, the ownership interests of the individual involved in the arrangement, and whether the compensation varies with the volume or value of referrals. Non-compliant telehealth claims cost Medicare $3.7 million in 2014 and 15. State regulation is expected to increase by state Medicaid fraud control units. Implementing change. Practice changes to adopt telehealth for hospice is recommended for patients in rural areas. Telehealth hospice allows patients to stay in their homes and receive optimal home hospice care. Remote patient monitoring and video conferencing can be cost-effective and useful for patients in remote areas. There is not enough research for telehealth in urban areas. The main objective is to have faster access to patients and symptom management needs. I can foreshadow video telehealth for hospice patients becoming a useful accessory tool, but it cannot replace face-to-face visits. What training programs are needed? The training of the hardware for telehealth applications should be minimal. Patients and families will have only the device and simple instructions on how to turn it on and request a video conference call with the nurse. Patients and families will be instructed to call the hospice by phone if there's any issues with the device or program. Employee training will focus on knowledge, skills, and attitude. Nurses need knowledge of the policies, procedures, and protocol of the organization concerning the use of telehealth technology. Security needs need to be addressed. The device should only be used for the purpose of telehealth, and privacy of the patient must be maintained. Nurse technical IT skills, such as the ability to use Windows, Apple, touchscreens, should be reviewed if necessary. As the hospice nurses use iPhones and laptops and touchscreens in their daily practice, the technical skills are already established. With any training, having a virtual environment or practice use of the program with other staff members will help in the confidence in use. Attitudes towards instilling confidence in the patient's use is paramount to having success in telehealth for home hospice use. Having confidence in use of telehealth will result in more nurses and patient use. Ongoing training. Ongoing training should be needed for the patients and families to reinforce when to use telehealth. How would you evaluate the success of change, the continued success of what you're currently doing? Formative evaluation, some examples are focus groups, peer testing, post-testing. Summative evaluation gives you a return on the training program. Reaction evaluation is the after training questions. Knowledge evaluation, a return demonstration, virtual environments, going over a case study. The business evaluation, we'll talk about the visor model. In the business evaluation, looks at how the training impacts or benefits the business. The organization compares the cost of the training and the value it gives the company. In the visor business model, the cost to deliver a product or service is sustained through the interface, service platform, and organizational model. Interface The cost of access device or adapting software for the device for service platform is the cost of the networks and the software, the organizational model, or the payout to the partners. ThruVisor, a successful business model, is one that is able to deliver the greatest value plan that makes the best use of the readiness to pay and the ability to lessen tangible and intangible costs of managing the services. How can we use telehealth in hospice? Biweekly scheduled calls to have the patients become familiar with the device and its application. The scheduled calls can be with a nurse or social worker with a set of objectives and cover specific to the patient and family needs. Hospice is unique in that it has a triage system in place for after-hour use. Patients and families can call hospice for many reasons. Using live video feed will help foster trust and give the nurse additional information to help the individual. During normal business hours, the team nurse managers triage the patient's calls and deploy staff for home visits when necessary. Hospice nurses will readily accept and welcome this technology that will decrease the number of emergency visits to the home because the nurse can be with them through a video and see what's going on with the patient or the family. Empathy, honesty can be conveyed through facial expression and verbal communication. The need for follow-up of an in-person visit due to liability worries can increase costs. The increased use of the program can increase overall costs. And having better access will encourage increased use, therefore increasing the cost. Cost for telehospice. So under the cost-simplified solution, GlobalMed telehealth hardware and software will be available for a flat fee starting at $7.99 a month. This allows healthcare organizations to establish telemedicine as an operating cost versus traditional capital expenditure purchase models that start around $42,000. Clinicians may choose to care stations that best fit their environment, transportable exam stations, wall dock, or the new express station. Global medical supplies in the station and diagnostic devices which enable evidence-based virtual visits. Who will be financially responsible? As a nonprofit organization, fundraising will be essential. How feasible is this change? It's very feasible. The organization was able to fundraise several $million for a new inpatient unit. As the demand has increased for community hospice, this investment for video telehealth will allow patients to always be connected to the hospice and feel secure. One of the goals of CHS is to stay technologically relevant. Telehospice will bring the organization ahead of the curve as we would be the only hospice with telehealth capabilities. Changes in public policy and technology advances in the future. As CMS moves to a managed care model for all services, including hospice, billing for hospice services will be changed. The Department of Health encourages Medicaid managed care, MMC, to use telehealth to give patients access to needed services. MMC will be able to request reimbursement of telehealth services in lieu of standard MMC benefits services. New York State addresses regulation, rules, and policies across state agencies to create principle governing of the telehealth. New York State regulatory agencies are in varying stages of implementation. Agencies should align on regulations and policies and ensure that the language used is consistent across all the agencies. The government needs to initiate additional work groups to address telehealth barriers. The future, as telehealth technology continues to grow and expand throughout healthcare, there will always be a need to educate on e-health use and communication expansion. Conclusions. Finding innovative, cost-effective, and community-driven approaches such as telehealth are needed to continually advance hospice care. The informatics nurse is an educator, director of patients and consumers to appropriate sources. As technology changes, the nurse will need to be able to adapt and add these changes into the application.